5 of our respiratory lecture series. So let's get started with it. So cold is a viral infection of URT, is upper respiratory tract caused by rhinovirus or coronavirus. Transmits through hands and by air. Practice correct hand washing technique, self-limiting. So there are the two kind of treatment we are going to cover is known pharmacological and a drug, pharmacological treatment. So if we are talking about known pharma treatment, then it is zinc, vitamin C and kinase C. And in drugs, expectorants, cough suppressant, decongestant refer to allergic rhinitis for drug chart, analgesic, antipyretic if you have symptoms of fever. So let's talk about expectorant and remove phlegm. So it include guaifenesin, which is mucinex, robitussin available, nausea, vomiting, diarrhea, dizziness, headache, rash, upper stomach disturbance can occur. Contraindicated if less than 2-year babies. Maximum 2000 milligram per day dose for adult. Cough suppressant includes it is DM 5-HT plus NMDA blocker if we are talking about DM, and benzonate. It's a topical anesthetics. So generic dextromethorphan, codeine, benzonatate, diphenhydramine. Dextromethorphan available Talisum, Dayquil, nausea, vomiting, drowsiness, serotonin syndrome. Mechanism of action used within 14 days. DM dextromethorphan includes the term DM use must be elder than 18-year-old to buy this medicine. Codeine, sedation, constipation, hypotension, respiratory depression can occur for more than 12-year age children. You can just give them. Additive CNS effect with other CNS depressant. Benzonatate, Teslan, Zonatus, somnolence, confusion, hallucination can occur. Diphenhydramine, Benadryl. Combination of product, generic, brand. Dextromethorphan, promethazine, bromophenamine, PSC, DM, Bomfet DM, promethazine, phenylephrine, codeine, promethazine, PC or codeine available brand. Guanafacin plus codeine, guanafacin, codeine plus PFE is available. So the brand is available for Rubafin AC, Vitusin AC, Cheratusin, Mitusin, DAC. So chlorpheniramine, hydrocodone, 2C caps, 2C and Vitus. It's a multinational. They are multinational brand. Pediatric concern dosing for cold medication. Per FDA don't use OTC medicine under 2 year. Codeine in child younger than 12 year. Elder than 12 year. Per manufacturer relabeled no child for under 4 year babies. Per AAP no child under 6 year of age. Do not use promethazine under 2 years of babies. Use hydrantine, nasal bulbs, 9 drops, spray, ibuprofen, acetaminophen. Do not use ASA, Rey syndrome can occur in babies. Acetaminophen in infants. 160 mg per 5 ml, 10 to 15 mg per kg dose, 6 to 4 hours as per needed. Maximum 5 doses in 24 hours. Ibuprofen in infants 50 mg, 1.25 ml. Suspension available 100 mg per 5 ml dose, 5 to 10 mg per kg dose, 4 to 6 hours as per needed. Maximum 40 mg per kg day per day you can use. So this is about a cold, and there are some home practice also available to treat your cold. Like we can make a lemonade, which is like boil lemon in water and add some honey, and if your honey is not available, then add sugar. It's also uh, welcoming and very good for the treatment of cold. And you can take honey with turmeric powder. So there's a lot of treatment you can cover with the cold. If they're not that severe cold and you can you can bear it, then just go into flow, and it will treat by itself because of viral infection. So it will treat by itself by the time in like 3 days. After 3 days, yes, you can go for a pharmacological or any non-pharmacological treatment, and you can also start non-pharmacological treatment from day 2 or day 3 using vitamin C and genius. So this is up to you. Thank you for watching my video. Please like, share and subscribe my channel for more videos. If you want me to like to share any suggestion for future videos, please do comments. It will be highly motivated and pleasurable for me to continue this learning platform for a medical professional. Thank you. Allah Hafiz.